Welcome back. Living with chronic obstructive pulmonary disease, or COPD, affects nearly every aspect of daily life. Yet nearly half of the 27 million people living with the condition wait years before receiving a proper diagnosis and managing the symptoms. My guest today, pulmonologist and COPD expert with GSK, Dr. Corbridge and Candace Norris, who's living with COPD, and we're going to talk about the importance of having an open conversation with your healthcare provider about COPD symptoms and how a management plan could potentially improve long-term care. Welcome to both of you.
Thank you.
Thank you.
Let me start with you, Dr. Corbridge. Exactly what is COPD? What are the symptoms and who's at risk?
Right. So thanks, Audrey. So COPD stands for chronic obstructive pulmonary disease. It's an umbrella term that's really meant to encompass two other terms, emphysema on the one hand, which is really loss of lung tissue or holes in the lung, and on the other, chronic bronchitis, which speaks to the effects on bronchial passageways, bronchial tubes, where they can become inflamed and narrow. And most people have some combination of the two of these under that term of COPD. Invariably, this causes shortness of breath. It also can cause flare-ups or exacerbations where there are specific times of really worsening symptoms that run the risk of additional lung damage. Most people in the United States develop COPD from a long history of cigarette smoking.
How is COPD diagnosed and treated?
So the most important thing from our point of view is for patients who are developing symptoms to get in early to see their physician and start that relationship that can result in a diagnosis being made. So patients at risk, so for instance, patients who've smoked cigarettes who develop symptoms should undergo a test called spirometry, which will kind of measure how the lung is functioning. And that's really how the diagnosis is established.
Candace, you're living with COPD. How were you diagnosed?
Oh, well, it's literally the breathlessness. I was diagnosed in 1996, and in the beginning I didn't take my disease seriously, which ultimately I had to. I had to become open and honest with my doctor, tell him exactly where I was at. I was actually embarrassed and didn't really want to open up in the beginning, but you actually have to. They can't provide a good treatment program for you until you tell them exactly where you're at.
Why were you embarrassed?
Well, I was a smoker for years, and so I actually did it to myself. That was my point of view in the beginning. But you have to get past that because your doctor's only there to help you, and if you're not honest with him and tell him what's going on and how bad your flares are, then they really cannot develop the proper program for you and help you.
What does a disease management plan look like?
So the disease management plan really is very multifactorial. It always starts with smoking cessation if that's still an issue. Appropriate vaccinations, very important. We definitely like patients to return back to being active, to exercise, and if possible to involve themselves in a pulmonary rehabilitation programs. And there are medications unique to the patient as guided by their physicians.
Where can we go for more information, Dr. Corbridge?
Well, I think we would refer patients to COPD.com. That's a site that has a wealth of information. You can navigate through that and get additional information that might be quite helpful to you.
If you have COPD, be sure to check with your doctor or healthcare provider for management of your health. Thanks so much for joining me, Dr. Corbridge and Candace. Thank you very much for sharing your story.
Thank you
Audrey.
for having us.
And I'll be back with more insightful, intelligent, inspiring conversations and information after this.